Used to go to the pool with my kids all the time.
Oh, no.
Yeah, sure.
Did you what's your relationship with
Yeah, no. And he owns a brewery.
Well, I think it is the operative.
Oh, the truck's not there
The
anymore?
truck's there, but I think that's around this.
Oh, that's really funny. I thought that
Brother,
was, so you know, Three Princes or Two Princes at the corner, yeah, at the corner of like, 13 and 22. Yeah, they own it, and his brother then yeah, but they're very quiet. It was very she moved, that one moved, she bought a townhouse. And he's a super, super nice guy. We actually talked to him in the month before he moved that I did, like 3 years ago.
Yeah, he's the only one that got this.
Yeah.
They're the guys who-
Interesting.
Yeah, right. And that one is, so I guess either Maine or US.
Oh, okay. I never seen that. Yeah, there's a couple of distributors. There's Celestial Branded people across the street. Yeah, there's. On weekends, and used to smoke out the neighborhood. And I was like, it was such a bad neighborhood. So leave what you want, but like, don't take my neighborhood. And then she's
good.
And she also indicated that right in front of your house and sell them for parts. So like one day the cars would be because I was like, first of all, this is unsightly. And I was like, oh my god, they're actually it's like party from the firefighter. Their music is like, if you show up at my birthday, one of my daughters, I just forget if I go to Bob, they were so lovely.
It's instantly like.
James is
I'll forget about that.
Oh, there you go. Yeah, that's what you do. And you hear like, right. Yeah, but then you hear like her entire life history of how she moved from England over, and I was like, okay, enough. Like I just.
Well, and if she had progressed.
We started shot at 9:55.
Yeah, oh yeah, several times. But that's great that you're there.
Okay.
I love, like I said, I love moving there. It's time for us to move out, but really good stuff
I'm
happening.
not sure why we're there. You know, apparently it's time for you guys to.
Yeah.
Right back.
Right.
What are you doing? No, I find ways, and frankly,
Yeah.
I don't know that it's more interesting. So if you were going to talk about then it is specifically.
I mean, it was difficult. Actually,
like I said, it was more about.
We can all work our way back to our seats, please.
Yeah, and when he finally.
Yeah.
So, but this is what I'm using. This is what I spend. I'm like, I know X-rays, history.
I mean, the process. On that, the other stuff. Oh, yeah, that's over here. Reason I was looking at this. Just trying to figure out.
No offense, Scott, you're the meeting.
Thanks for coming.
So your number one cheerleader's gone.
I haven't seen you in ages.
I know. I've seen residents here.
Everybody's here? You're here too? Everybody's here.
It's been doing this about 3 months.
Give me a badge.
I'm surprised it did. It's only 2
I'm
mistakes.
not, I mean, I know the owner.
How's younger?
Nobody knows. He ran away. He's disappeared. I helped him move into his place in Canada. He's got a place in Canada. And I helped him move some stuff up to Canada, ran into all kinds of problems at the border.
Oh, wow.
It was terrible. Like, my family was like, our car was stripped, like, and then he vanished. All right, look, I got the microphone, and we got the live stream. So now the people at home can hear us. So just so you all understand something, Monday and Scott here, I called them Monday night to present because the original presenters for today, who had been scheduled for a month, called me Monday morning and said, "Oh, I gotta get my hair washed or whatever." So we appreciate Scott coming in. The thing about this presentation, and Scott, no offense, pay very close attention because it's going to be interesting but difficult for some of us to follow. But I like this a lot. I like this stuff. I've been in the tech industry, the hardware tech industry for years. I'm bored with it. This stuff is exciting. This stuff is very difficult for me to understand, but the outcome is great. So without any further ado, Scott, please take the podium, and if you'd like to use the microphone, please.
I'll start
have to. You do, because there's people watching on the live stream.
So I'm
You
easy.
don't have to be that close.
Good morning, everybody.
Good morning.
Yeah, you can further along.
So pleased to be here. Thank you, Marty, so much for the surprise call on Monday. What's really cool about this for me is that this is the first time that I've presented this company outside of a very small group of people. That small group of people is Nick, who just left. So now you're all going to hear what I've been doing. So by way of introduction or the story behind this, I've been a lifelong biotech guy. I've been a
Now, I'll point the camera. You just got to keep it. Don't worry about
I'm going to move around a lot.
it. You just kind of stay in the front row. There you go, on TV. So,
I'm on TV.
TV, go ahead. There you go. Perfect. Anywhere alone, I'll watch it.
Shall we start over?
Yeah, it's perfect.
All right. So anyway, I've been a lifelong biotech guy since the 80s, and my whole career has been in recombinant protein production. So the last company I was with was for 14 years, and back in about 2008 or 9, I came across this idea. We were working on a particular protein, developing it for a disease called fibrosis. And me being a protein engineer, I thought, oh gosh, we could take that and we could play with it. And it's what I told Marty, it's Legos of proteins, basically. Protein engineering is designing novel structures and using cells to produce those products. So what I'm about to show you is kind of the fruition of that dream from 15 years ago now. I've been sitting on this, and it took the pandemic to actually get me off my butt and say, out of regret and minimization, thinking, if I don't do this now, I'm never going to do it. So that's why I'm standing in front of you today, because this idea just never went away. So my company is called Betraveled, and my mission really is to orchestrate immunity to treat human diseases. I'm Scott Willett, but you can just call me Scott. And right now this company is basically me and my research associate, Kevin. We both work at the Blumberg as the academic program. So we spend most of our time chasing high school and college kids around as interns. The other half of my life I spend in the teaching lab, which I'd be happy showing you, and developing these ideas. So Marty said, he gave me the format. And I thought, well, I'll provide a context of how I view the industry in which I live. So there's basically a cultural view of this. You have small startups where you have people who have to innovate. Our modus operandi, our motivation in life is to invent and to create and develop new ideas. Then you have large pharma companies whose purpose in life is to return value to shareholders. So this is a great marriage, I think. It's a nice mix. Those of us who innovate are willing and, in fact, thrive on taking crazy risks. Everything on Black 17. And to say, I think this idea is great, I'm going to develop it. And what we do by virtue of that, we're virtually without resources at the very beginning, is we have to operate very, very lean. What that does is it focuses the mind and causes you to do only the things that you need to do to move the ball, versus a very large company that can put a whole building of people on the problem and go that way. So this makes a very interesting cultural juxtaposition. Those of us who are innovating are developing products, and what the industry calls it is de-risking. So the farther you get down the development path of a drug, the more the risks are mitigated, which means basically from a commercial point of view, if it's de-risked, it means eventually it can become a commercial product and make money. So the model that I really, when this emerged over the years, large pharma tends to be rather risk averse, and small pharma tends to enjoy risk. And when you put the two together, you've got a machine that generates ideas, de-risks them, and then can offer them up to large pharma and they can buy them. So that's my whimsical view, really, essentially, of how I fit into this. Here's contract. So what we're doing is developing a novel platform based on, excuse me, an endogenous human protein called pentratsin. And what we can do is apply that to three basic product categories. We can make vaccines out of it, we can make therapeutics out of it, and we can make diagnostics out of it. Essentially, one molecule I can engineer in three different ways to create three different product lines. Very, very efficient use of protein. And the reason that's this product is probably very interesting, I think possibly very, very valuable, is that the ability to create higher potency therapeutics and vaccines will reduce cost and increase efficacy. Something that's greatly needed. If you've looked at the state of our vaccine technology, there's big room for improvement. And of course, there's always room for improvement in increasing efficacy and lowering the costs of biopharmaceuticals. In addition to that, we can create very sensitive diagnostics using this platform as well. So the potential exists for actually the entry into food markets with one basic and rather simple idea if you're a protein engineer. Here's the questions for you. First, I am essentially pre-funding. I have one grant from Pennsylvania State via the Biotech Center who were very gracious in offering me $250,000 to kind of get out of the starting gate. But I'm in a situation now where I need to get the next round of funding, as many of us find ourselves in that situation. So I'm not a business guy, I'm a scientist, and funding to me is something that other people have always done. So I find myself in a position where I need to start gathering expertise and asking, how do I do this? What's the best way to proceed? Is it non-dilutive funding with NIH grants? Is it looking for angels? Is it ultimately looking for venture capital? I'm really not very well versed in that. I would love some guidance on that. Next, so I mentioned that there are three different platforms we can make with the technology. But to address Nick's question about focusing, it also makes sense to me as an engineer that the most efficient way to do this is to focus on maybe one of those arms. And so a question to you is, after you see what I'm going to present here, think about which one of those arms might be the best way to focus. Is it going to be a vaccine, a therapeutic, or a diagnostic is the best way to develop the company? Excuse me. Also, the team. I'm in a situation where it's just me and Kevin in the lab, and I'm very aware that I need to gather a team of people around me in order to do this. So I need guidance on how to assemble that team and who should be on that team. Do I prioritize business, legal, technical? I need all of it, I know, but strategically thinking about how to build that team would be, I'd appreciate some feedback on that. And of course, as you've seen, it's three different arms of a platform. And it occurs to me that maybe licensing the technology would be a good way to grow the company, or the alternative that at least I'm aware of is to an outright sale and acquisition of the company. So if you can think about that and maybe help me kind of noodle through what's the best way to proceed. Okay, so yeah, or bourbon.
I do have bourbon.
Too early? Too early. Here's the technology. So let me tell you a little bit about the protein that is the background of this. This protein here called pentratsin. It is part of our immune system. Everybody has this, or multiple versions of it actually, floating around in our blood. And its primary job is to recognize, bind to, and help clear pathogens and damaged tissue. So it inherently interacts with the immune system to help that happen. And it occurred to me as we were developing this as an antifibrotic that I can engineer it and give it other purposes, basically repurposing the molecule to accomplish different tasks. And the way to do that is by making fusion proteins. Oh, thank you, Tori. Cheers, excuse me. Okay, so we can repurpose a molecule by making fusion proteins. Now I know this is verbiage technology. But think of a protein like a string of spaghetti. And on one end of it you can put, excuse me.
Sorry, you want orange juice instead?
Maybe the burn.
Anybody coughing at a biotech center makes me think this is patient zero right
Sorry, my allergies are getting me. Anyway, so you can add more protein on one end of this molecule, and that's what a fusion protein is. Now you either add, thank you. Hey, that worked. I can either add an antigenic peptide, which would be a sequence taken off the surface of a virus, for example, that stimulates the immune system to create an antibody response. Or I can add a single chain antibody domain. And this is a piece of protein that's just like an antibody, but it's just one domain. It can bind to a target. So for instance, hepatitis B virus. I can create one of these contractile fusion proteins that binds to and inactivates hepatitis B virus. Or with a different domain, I can target any virus or any pathogen that I like. So that's a therapeutic. And then the third is to create diagnostics. And the way to do this is to create heteropentameric molecules where I include a targeting domain, these VHHs. There we go. These targeting domains, and then a signaling protein or a signaling dye that can give a signal. And that's basically what a diagnostic is. So now what I want to do is just show you either conceptually or with a little bit of data, the three applications of the platform so you can kind of see. And my goal here is really not to bury you in tech, but just to demonstrate that the ideas are feasible. So I'm actually making these proteins in the lab, and I think it's looking good so far. So this is an idea of the vaccine technology. And here's an example of a monovalent pentagen vaccine that has one single amino acid chain on each of the 5 protons of the molecule. Here's an example down here of, I can put up to 5 different energetic domains on there, which makes what is called a multivalent vaccine. Are you guys familiar with vaccine technology at all? So the idea is that I can now raise antibodies against either one antigen or against multiple antigens, and configurations like this might actually be very, very potent because now your body can recognize different facets of a virus and attack it from different angles. What's nice about this is these are easily designed just using available sequence information. All the surface proteins on viruses are known, they've been sequenced, and all I need to do is steal the amino acid sequence with pieces of it, put it on this protein, now I've got a pentagen. And here's a really interesting trick. This molecule, pentraxin, in the presence of calcium, forms a colloidal suspension, which is basically like a cloud. And it's basically a particulate. Okay, I'm gonna move on. Okay, staying down here. Whoops.
Oh gosh.
There we go. All right, so a couple attributes of this. They're intrinsically non-toxic. They're intrinsically adjuvated, which means you don't need to add toxic adjuvants to them in order to stimulate the immune response, because the molecules naturally interact with the immune system. And that can make them either mono or multivalent. Here's a little bit of data on the pentabody idea. So these are therapeutics. When you give these to somebody who has a virus and is targeting that, it crosses the virus. Think of like Velcro that can make a goo ball out of the virus and then stimulate the clearance of that. So it's a good way to inhibit virus. And what I'm showing here is that this is one against hepatitis B virus. An IC50 is a measure of its potency. The lower that number, the more potent the molecule. And this is 1,000-fold more potent. This is the pentabody version of it versus the monomeric VHH. That is 1,000-fold more potent than that, which indicates that the idea actually is valid. And then also, monoclonal antibody targeted to the same proteins is at least 5-fold more potent than that. If you know antibodies, they have 2 binding domains, and my peptides have 5, so you might expect a 2-fold increase in potency, but I have 5, and depending on the assay, up to 50-fold more potent. So this is one I think has legs. These are very easy to make and can be an excellent competitor to any monoclonal antibody therapy that's out there. And now the third.
This is where you lost me.
Right, so I'm sorry. Don't just move on.
We'll get to the business stuff.
Yeah, just go through it.
This is the part where I was like, okay. Yeah, we should probably get to your questions.
All right, two true deep. There you go. You can make antibody conjugates or pentibody conjugates or diagnostics using this technology. This is just for me pure joy in the lab to do. Okay, and here's an example of diagnostic work. So I've made one of these proteins that has a fluorescent protein on it, and you can see in this slide here, those cells lighting up are indicating that I've got a targeting to those cells and light coming off the fluorescent protein. And that's good. Okay,
What are your questions?
What are your questions?
Are these proteins in the room with you now? No, sorry.
I love this way. So please forgive the science.
No, it's just, it was like, it's really awesome, but wow.
Okay, this is where we live.
Do you want to read through your questions one time for us?
Sure, okay. You want to read through all
I'm sorry?
of them? Or just one at a time? Just read all of them?
No, just read through all of them.
Okay, what is the best way to fund the company? Which platform should be prioritized? What team strength should be assembled first? And is the platform better suited to licensing or acquisition?
Okay, great. So independent of the science lesson that we just got, anybody have any comments or further questions?
I'm just curious, like in terms of the development process, where are you? Are you close to, like, are you getting close to like doing the animal models or clinical studies?
Very early. So I'm in, I call it starting gate. I'm in the tool building phase of it. I'm putting together molecules, the first versions of them, and just showing proof of concept. So my primary goal right now will be is to create data that I can use to write a patent application with it and get this patented. It needs to be covered in IP.
Yeah.
And then I'll proceed down the development path. But the development path is dependent on which of these arms we take. So a vaccine development path is different from a therapeutic, different from a diagnostic.
Right.
And me being one guy, I don't think I can do all 3. So I kind of need to figure out what would be the best way to go. Yes.
I just wanted to make a comment. I actually got to meet Scott a few years ago. My company gives EITC money, and what it goes to is, I think, Scott, you were running the AP chemistry class that happens here for high school kids. And it's a great program. Kids get to do hands-on research in a real environment. And if you have kids that are in, Central Bucks, try to get them in, and they're interested in chemistry. It's a great program. They take, 14, 15 students. I got to meet some of them a couple of years ago.
Yeah.
They were doing really hands-on research
Oh,
in a
yeah,
real
great
environment in high school.
Yeah, that's Central Bucks. Mark Hayden is the AP Chem teacher.
Yeah.
And I'm the lab rat.
Yeah.
Who can show them their projects.
Yeah.
It's really fun. These kids are amazing.
Yeah.
Yeah. Thank you. Yes.
So Scott, practical question that might actually derive the answer. How much can you share? How effectively can you do any of the other 3 without having your IP protected? So, and by that, I would imagine that would equate to technical.
Right, it would. That is, it's a balancing act. So I need to divulge enough to attract interest,
Right.
but not enough that the agency can say that's prior art.
Yeah.
So I can't publish anything. I'm trying to limit my public speaking as much as possible and only give surface information.
So you're saying the coughing was actually just a cover up?
So very strategic, yeah. Forgive me.
Everything in the deck is completely fake, so if they copy it, it just tanks their whole project.
Yeah, there you
Or
go.
we didn't understand it anyway, so it's really no big deal.
Okay, I'm sorry for the tech.
Oh, God.
Sorry, I'm a bad student. Can you go back to the beginning, just run through the slide, I missed the beginning. I get the science part before that. Okay, so here,
Company, that's our mission, that's me.
community, so you're trying to do something like the mRNA, kind of changing.
No, these are recombinant proteins. They are the molecules themselves, are either the drug, the vaccine, or the diagnostic. The diagnostics need to be assembled in kits.
Right, and you don't have a disease at this moment, or you do and we're not.
I've generated molecules against hepatitis B virus, so the data I showed on the antibody was hepatitis B virus. I've also generated molecules that go for respiratory syncytial virus. I'm about to do H5N1 influenza that's coming. So you can apply this to any virus that's out there, easily to any virus. You can imagine going after cancer with the pentibody drug conjugates. So the proteins themselves are the prize, it's not mRNA type.
Okay, all right, well,
Okay,
let me think about it for a second.
okay. Romy.
Yes, I'm just thinking in terms of funding, just because I've been all over the place with who you're trying to raise money. And what I've heard a lot is, this whole region is very focused on biotech in terms of the funds that are available. So I know you know about the Hatch Fund, so because we've talked to Louis and he's mentioned, this is mainly for biotech and so on. So I think I almost feel like you have access to a lot more, let's say, than even we did. I think some of the places that we have presented are to Ben Franklin Tech Partners. You know about them. I don't know whether they come in at this stage, but I imagine they would. Also, MADV, Mid-Atlantic Diamond Ventures. I don't know if you're aware of them. I can connect you with Ellen Weber if you'd like. And yeah, and I know they have an event coming up in September, because I was talking to her earlier this year. Maybe you can present there, of course, all the high level stuff, but I think there's a lot of interest in the work that you're doing. And I'm trying to think about some more funds, but those are three that come up. But BFTP and MADV I know are playing very deeply in biotech.
Okay, thank you
I
very
have
much.
to wait for Jen.
Marty, we're gonna let Marty talk.
So back to the funding slide, go back to the funding slide. I'm gonna second Mid-Atlantic Diamond Ventures. And if you can,
Where's the funding slide?
this is the first question, best way to fund the company.
All right.
The subset of funding the company though is, do you want to jump directly to basically venture, giving up equity and based on an imaginary valuation and giving up ownership? Just to be very clear, unless you're given a grant, every option she has brought to you involves giving up a percentage of your ownership stake forever. So, and part of the giving up, so I like venture funding. We're a feeder to venture funding, but I don't think people realize all the time that taking venture funding means, giving up a board seat, right? Or giving up, some voting shares.
Understood.
And stuff like that. So yes, venture is fast, but it comes with a leash.
Right.
So
And that's been my understanding, to start with non-dilutive grant money,
that's right.
move to angels, and then get into venture,
Right.
as the general scheme. But I thought I would lay that out to you and see if anyone has.
For this stage, grants are going to be less intrusive, but take longer. So I recommend that we're going to do a grant program through Startup Bucks that's Penn Community. I'm going to recommend you apply for that, but the bigger dollars are going to be in venture. So if you need big dollars, venture is going to be the way.
No, I think under $1 million can get me out of the gate.
Ask Mumpy how hard it was to get $1 million.
Yeah, it was.
Very hard.
Mumpy was calling me at 2 a.m. You got $1 million you want to give me?
So once you have your capital in place and Brandon has protected all your IP and all that, who's your ideal client? Like, who do you sell this to or market this to?
So ultimately, it would be another pharma company.
Okay, like
Somebody with
a
the
firm or
infrastructure. So
got
that's
it.
what I was trying to convey in the first one, that cycle of we innovate, they buy, and then they take it from there.
Okay, thanks for clearing that up, Brian.
So I think I answered question 3 weekly when I meet with companies. So I'm happy to discuss that with you as well. So I'm economic development for the County of Bucks. So I meet with companies of different sizes frequently. But you have on there legal at the end. I would just make sure that, your legal is all sewn up, so your business development people can go out and do what they do, and when they get questions like, what? They can answer questions if asked, and so they're not saying, well, I can't tell you that, or I don't know.
Right.
Because then your business development doesn't work. So, and your legal department is gonna say, be careful with this, be careful with this, be careful with this. And like, what do I say? So I'm trying to help you with trying to help you answer that question, but ultimately they're gonna, caution you for this, this, and this. If you wanna, your salespeople need to be able to, sales/business development need to be able to explain what they're selling and answer questions.
Excellent, and they should be covered with IP before.
Right, so you sort of, as you cover the basis, and I always direct my people to, talk to is there an HR professional that you can talk to make sure that's all of your people are in line and are singing the same song, have the same message.
Thank you.
That call later. Foxwell's child is here.
Yes.
So, okay, to answer your question, vaccine, therapeutic, diagnostic, they're all scary in, different ways, right? I think the vaccine is the one that you're talking about with, flu, H5N1, but be very broad based. The thing is, there's probably a lot of folks that might be there, and depends on how it comes out. So I would really think about rare diseases as one that you target and take a look at. Like, if you can find one with a rare disease, that expedites everything through FDA and things like that.
Right.
So that would be my suggestion. Like Hep B, I think there's like already a vaccine and things like that. So,
There is.
so I feel like that's, maybe not the first place, but if you could do rare disease showing, something that nobody has, right?
Right.
Or vaccine, because that impacts most of the population, I would think. Those are kind of your two best bets.
Great.
Because of where you are.
Thank you. All right.
Scott, I'd say on the legal, for us, Fox Rothschild has been quite amazing, right? We had deferred, and I'm not sure they may have different terms now. But, we had deferred, payments, for instance, until we raised X amount of money. And in terms of legal protections, we feel very comfortable that before we talk to anybody, we have the NDAs that were needed. Before we get quotes from manufacturing, we have those. We have protections if something goes wrong in manufacturing. So, and they did all that work for us. They're costly, but but they do a phenomenal job of making sure that your IP is in the right place. So,
And there's the guy.
Yeah, no, I'll echo that. We do have a bunch of different offerings for startup companies that, we want to, build your platform from the ground up. So you have a strong foundation when you do go out and market. Everything from IP protection to, like, what are you saying, confidential information, wide range of offerings. We're a national law firm with 30 offices. So we have, practice groups in every area you could think of. And we, even off of that, not even legal, we offer, business development people to meet with you, come up with a pitch deck that is really straightforward to the point that, non-technical or.
Not like this one?
No, this is phenomenal, but I'm saying like a much more straightforward one that gets your point across that everybody can understand, really dumb it down for some people like me, maybe that's not very technical or scientific oriented. But yeah, we have a wide range, and I'd be happy to talk to you about that.
Thanks, let's do. Okay, good.
Any other comments? Brian?
I'm curious how licensing would work in the diagnostics specifically. Like, would you be licensing the ability for them to add whatever they wanted to it and then diagnose it? Or is it just like, oh, okay, you want to diagnose this, let me build you this and then hand this off and then you can use it for a couple of years for licensing?
The nexus there, if you will, is if you're going to use a Pintraxin and put a targeting domain and a signaling domain on it, that's my technology, you can license that.
So
and you can apply it to whatever.
And then they could signal whatever they want.
Yeah. Just a thought, anyway.
Yeah.
I'm not really savvy with licensing deals, but that would allow me, if I grant them a non-exclusive license to use the technology, then I can go to a different company and say, you want to develop this? People are pretty siloed in these things. Like, we do diagnostics for X,
right?
They do diagnostics for Y.
Right.
So pharma is built on the silo structure, and so being able to license this because it can go across any indication.
Right.
Seems to me at this point more lucrative than selling the whole thing to one company.
I'm just wondering if that's a place to start, like a growth strategy, right? Because you get a little bit in from the licensing, not as much as an acquisition or anything, and use the diagnostic space if you can resell to multiple ones in there and sort of use that as a revenue generator model for you to build maybe the big payday later or something.
Possibly, in fact, we're having discussions right now with a company here for developing a diagnostic for dengue fever. So that's happening, it's just early days.
Right.
And I'm spinning plates kind of a thing. So, or sticks in the fire, however you want to think of it. I'm spamming everybody who will listen. Thank you.
I was just gonna say, we're in a pretty rich academic medical center environment. Are they a potential partner for you guys? Can they help better define the platform you should pursue from, vaccine, therapeutic, diagnostic? Is there value there?
I'm sorry, who's they?
Your academic medical centers, your Penns, your Jeffs. I mean, we're in a pretty rich environment here in, greater Philadelphia market. There's a lot more penetration, of academic medical centers, versus being rural. Are they potential are they value partners?
They would be, I would view them as maybe scientific advisory board types, maybe not biz dev.
You do see some spin-offs like from Penn and things like that.
Yeah, there's quite a bit. And we're associated with B Labs downtown. They're involved with Penn and Drexel as well. So yeah, the academic industrial connections really need to be exploited. Yeah. Maybe that's not the right word, but those are fertile partnerships and need to be maintained. I'm just making initial connections now. Thank you.
Anyone else? Thank you very much.
Thank you so much.
So you can see where you sit there, and I'm like, wow, that's some science. It's good to see people actually doing the work. And the Biotech Center, once again, thank you for the Biotech Center. So, we usually leave the last half hour or so for people to hang out and things like that, but I do have a couple of short, little housekeeping things. I don't want any leftovers here. I brought little Ziploc bags and carry bags. Take everything and anything, leave nothing behind. Take the coffee, take the utensils, take the chairs, just take it. I despise throwing away food. Absolutely despise it, so please take it. And eat it, but just take it so I stop talking. Secondly, we are very aggressively trying to populate the F30 presenter calendar. Again, after the experience I had this summer, I am seriously considering not doing July and August because everybody is on vacation. We've turned into Germany. It's just everybody is out of town. So, we'll take a look at that and see if we're doing it. The next session will be in September. I have some presenters, but you could nominate anybody, any company, your neighbor. Doesn't matter. Again, based in Bucks County, getting going with real questions that the audience can answer. As always, the audience here is very important to us. We do live stream this. So if you can't make it, it's on YouTube. Just go to startupbucks.org and you'll find it. We link to it. We will be answering questions from the online audience if we get enough people. Generally, we only get 3 to 5 people. But if we get enough people, or if you have students, if you're a teacher and they want to see this, direct them to the YouTube channel. And then the last thing is we are more aggressively pushing into the go side, the funding side of things, because everybody's asking us for money. They mistakenly think we're the funders. We're not. We're the administrators of the funders. We find the funders. Venture capital has been very weak for the last year or so. I think Fox Rothschild, you know that too. Like all the venture capitalists took their Lego and left. They're coming back out of the woodwork. I don't know if you've seen that, but we're hearing funding events. Maybe was that venture funding you took or some other kind of funding? Can you say?
Yeah, that it was. Yeah, you could say it's venture funding, but
venture-ish?
It's a fund.
Okay.
So, for how long were you beating the ground, just trying desperately to get,
For a few years.
Yeah, so last few years,
Yeah.
but I'm seeing venture open up in Bucks County, so that's good. But I'm also seeing other forms of investment, family offices and things like that. So keep your ear out. If you hear of anything, send a message to team at Startup Bucks. That would be really helpful. Be ears on the ground. Finally, we're thinking about new ideas for the gather stage. And one of those ideas is office hours, where if you have an idea and you want to talk to somebody,
This time we have Ryan Cummings here. Ryan has just enormous number of things that will answer your questions of how do I get people to work and how do I, training and money and all that other stuff that building a workforce. So he's got great resources. Fox Rothschild, thank you so much for coming. They're not free, but but they're here. They show up, and if you just have some kind of ballpark legal questions, just go sit down. You're not going to get into these guys without an appointment normally, but if you come to one of our events, there's somebody's going to be here from Fox.
Happy to always talk.
Right. And we occasionally have Elizabeth Siggety, one of our board members, and she's like a partner there in some sort of thing. I don't know. She's like a big deal. Her name is on the side of a building nearby, so it's like funded by. But anyway, but this isn't possible without the audience, and bring a friend. Also, if you can bring a young person, if they can get here on a Wednesday, if you teach, we are very happy to we'll host a field trip. If you want to bring your students here for a field trip, we would love it if we could see some high school entrepreneurs here. I would love to see more faces under 40 in this room. No offense to anybody who's actually under 40 right now. But the point is in every organization I belong to in Bucks County, it's gray hairs like me. Everyone. We're all old. I'm a volunteer firefighter. There's not a single member under 40. Okay? We need younger people to realize making a business is a possibility, because they're going to be the ones building businesses that pay the taxes so we can get applesauce shoveled into our face when we're all waiting for ourselves. We need that. All right? So, thank you for coming. Enjoy the chit chat. We have the room until 11, so you don't have to run out the door right away. Have a great day. Thank you.
That wouldn't have been a better show. That was the point I was making. If he doesn't have that, he doesn't have his IP program.